My name is Avery Lico. I use she, her pronouns, and I'm the California Heal Program Manager. I manage and accompany our California fellows with the HEAL program, which includes the social medicine fellows. You'll be hearing from a variety of HEAL staff as well as our current fellows for this info session. And like I said, please feel free to ask questions along the way. We will have about a 10-15 minute Q&A at the end of the session. All right, and kicking us off with a poll, we would love to know, where are you calling in from? Right, and we will give y'all just a few more seconds. Sweet. Varsha, do you want to go ahead and share the results? Cool. Well, it looks like we've got folks from all over. Thank you, folks, for answering. Um, we're very excited to have everyone here. You do not have to be from California to apply from this program for this program. And diving right in, well, first of all, sorry, having some difficulty issues. Before I pass it off to our co-founder, Shri, this info session today will start off with HEAL's history and why we've decided to expand and grow in our home state of California. We'll go over the program and itself, as well as the hubs we work with in the state of California. And we'll finish off with what the application process looks like and end on Q&A. And with that, I pass it over to Shri to talk about the history of HEAL.
All right. Thanks, Avery, and thank you all for being here. I'm Shri. I'm internal medicine trained, have been at UCSF for a number of years, and actually, when I finished residency, I trained at the County Hospital in Los Angeles, Harbor UCLA, and coming out, I knew I wanted to take care of resource-denied populations, probably at similar stages as some of you, and I basically split my time between San Francisco and different parts of the world. So Rwanda and Burundi and Haiti and rural India, like 6 months a year. And one of the things that led to starting HEAL was this idea that, how do we do this work in deep solidarity? If you're outside communities that are not your own, how do you do it in solidarity with, folks that are running the marathon, like our Haitian colleagues or our Rwandan colleagues or, our Central Valley colleagues, and really going in with humility and working in teams. And so, from our experience in Haiti in 2010, where that was the massive earthquake that happened January 10th, 2010. I was there for a number of weeks, as well as the other co-founder of HEAL. And something that was very obvious, in retrospect, is that there was very little thought given to building the workforce capacity of Haitians. There was a lot of people coming in from the outside, but even months after the Haiti earthquake, there wasn't a really deep thinking about Haitian workforce capacity. And so that led to us thinking about what would it look like to build a program like HEAL that had a number of creative constraints. First, it couldn't be about just physicians. It had to be health workforce across both interprofessional and interdisciplinary. When we started HEAL, it was both focused on domestic work and international work. We'll talk about the California program. We had to figure out kind of also the funding model of HEAL and really try to build the model that does justice to the communities that we're trying to serve. So, yeah, that's kind of the origins back in 2010. And then this is, potentially a little bit of a esoteric slide for for some of you, but this is a really powerful book that I really like. That's a conversation with this phenomenal educator named Paulo Freire, who wrote this book called Pedagogy of the Oppressed with Miles Horton. And Miles Horton is a uh, a person that ran something called the Highlander School in the South, and it's a civil rights school that started just being an adult literary school for miners, so people that were working in the mines in the South, and it actually became a school that taught all the civil rights leaders, many of them, John Lewis and Rosa Parks and Martin Luther King, and I think one of the powerful pieces hearing Rosa Parks talk about what made Rosa Parks. She credits the Highlander School where she said, I learned how to be an organizer, but I learned something more. I learned a different way of being in the world and a different way of operating. And I think that's what is called upon for us in this moment in healthcare. I think, with the ICE raids, with all the Medi-Cal and Medicaid cuts, with the USAID gutting, like it can't be business as usual for us in the health workforce. We have to reimagine what it looks like to be health workers at this time, to be advocates, to be leaders, to work in community, to do hard things together. And I think this book and Highlander, is something that Heal kind of draws inspiration from. And if you throw your hat in to apply for Heal and potentially be a part of Heal, I think one of the things we really think about is kind of fit and, making sure that Heal is something that's a good fit for folks coming into this community. But you join kind of this movement of now close to 270 health workers across the world from Navajo Nation, which is an indigenous community in the Southwest, to a number of countries internationally. And now your cohort will represent the third cohort of the California Heal program. And, really like our work in Navajo Nation has been longstanding for the last 11 years. And during COVID, we really were able to kind of step into there was a massive surge in Navajo Nation, and Heal was able to respond and support when a lot of our Navajo colleagues talked about already being short-staffed and really needing some support. And coming out of that, that work got a lot of kind of press and publicity because, during COVID, of course, everybody was thinking about health equity, which is not the case at this moment. But coming out of COVID, we were able to speak to a number of communities in California, and we were invited in to essentially do the same work we've been doing for the last 10 years in resource-denized parts of California. And so that's led to our California program. So the program that we're going to be talking about today is built over the last number of years, over a dozen years, and then is really kind of tailored and supported by the communities that we're working in right now. And so this, I think, those of you that are working uh, in healthcare in California or in many parts of the world, we all know that the places that have the highest burden of disease often have the least number of health workers. And we believe that, if you support those health workers and grow them and upskill them and bring them into the community, like it can drive both retention and also, like I mentioned, kind of reimagine what it looks like to come back to why we went into healthcare in the first place. And so California is no exception to this, the theme across the world where a ton of people live in health profession shortage areas. And so our goal in Heal is to really lean into those areas and try to build kind of a community around doing the work in those communities.
All right. Thank you so much, Shri, for sharing a bit about the background of Heal and how and why we decided to grow in California. For this next portion of the session, we'll be talking a bit about the details of the program itself and what your fellowship year would look like. So, to set the stage, Heal has two types of fellows. As Shri was saying, the HEAL model really prioritizes justice and integrity and solidarity. And that includes bringing on both physicians, which are social medicine fellows, as well as what we call community fellows, which are folks who are non-physicians, they're health workers of all cadres, and they're already working in the community that we partner with and serve. Our community fellows we recruit for a bit later in the year. We'll be recruiting for them in December, and they actually stay employed at their site. And then our social medicine fellows are physician fellows. These are med peds, IM, FM, or peds folks, and they become employed by UCSF Heal and work at their hub. And this is who we're currently recruiting for. All right, and a bit more about the program. It is a one-year social medicine fellowship. It includes one-on-one mentorship with our physician hub leads based at each hub. These are experienced, um, powerful, empathetic, well-connected folks who can support you with your own career and growth. Additionally, what is unique for this program is we offer 70% clinical time in addition to 30% protected social medicine community health work time. So if you were to elect to do this fellowship or be selected, you would have 30% time to work on a community health equity project within the community that you're serving. And then additionally, throughout the year, there are various in-person and virtual trainings. There's plenty of opportunity to connect with our other cohorts, such as our Southwest Indigenous cohort based in the Navajo Nation, as well as our Malawi program, in addition to our 270 plus alum that are based globally. And then the benefits for social medicine fellows, it's up to 160K salary, as well as comprehensive UCSF benefits. As I've mentioned before, a peer cohort of not only physicians, but also local health workers that are values aligned and community aligned. And then additionally, as if it's not already clear, once you're part of the HEAL community, you get to stay a part of the HEAL community, and that's long lasting. And then this is just a brief snapshot of what a program calendar year at a glance would look like. The program kicks off, excuse me, sorry. The program kicks off in July of 2027 at our Global Health Training Intensive, and this is in the Santa Cruz Mountains for 1 week in a space that's very disconnected from the noise of the outside. And we all come together, our California fellows as well as our Southwest fellows, and come together and dive into the HEAL core curriculum, which covers topics ranging from power and privilege, structural competency, and well-being, just to name a few. And then you go back home to your hub and have your first monthly hub meeting. A bit more about that. Our hub meetings are led by our hub leads. They are in person with just the fellows located at your hub. So that would be just the other social medicine physician fellows and just the other community fellows based at your specific geographical hub. And then throughout the year, every quarter, we have different in-person quarterly gatherings where you actually get to travel to each hub. For California, that is Fresno, the Inland Empire, and Los Angeles. And you actually, as a fellow in your specific region, get to take a part in planning that regional gathering and getting to sort of display and show off the community that you're a part of. And then the year, excuse me, ends at our graduation June training in Flagstaff, Arizona, again in tandem with our Southwest fellows, and you get to complete the program. All right, next we will be diving a bit more into the three hubs themselves. So as you can see here, we are currently based out of our partner with Fresno, Los Angeles, and the Inland Empire. And part of the reason why we work with these three specific regions is because this is where the highest need is for health workers in workforce development and health. The HEAL model works with a bunch of threads of a clinical site, FQHC, where you would do, as a social medicine fellow, your 70% clinical work in tandem with either a CBO or community business org, or maybe a public health department or a free clinic where you would do your 30% protected time project site work. And then also, we typically partner with a UC in the area. For example, in Fresno, we partner with UCSF Fresno, and in the Inland Empire, we also have partnership with UC Riverside. And then tying this all together is HEAL as the backbone organization. So for this next part of the presentation, you're actually going to hear a bit about each hub from fellows or folks who work in those geographic areas. And I will pass it back to Shri to talk a bit about LA.
All right. Yes, so our newest hub is in Los Angeles, and there's a few FQHCs that we've been talking to, and really, the filter is different FQHCs that are very committed to health equity, health justice, that have, a need, but also can support a fellow. And so there's this clinic in Los Angeles, South Los Angeles, called Umma Health, that initially formed to serve a Muslim population, but now is definitely like all comers, but serves a largely Medi-Cal population, is quite well run and has works in public schools as well. So they're combined with Harbor UCLA, which is the county hospital in LA. So sometime at the FQHC doing outpatient work as well as in some inpatient work at Harbor UCLA. That's kind of the structure of the 70% clinical time that would exist in South Los Angeles. So that some of the details on the project work, the 30% time, are being worked out, but there's no obviously shortage of need, and there's some incredible mentors in Los Angeles that I've had the pleasure of working with for the last number of years. And so just the ecosystem, I think, is strong. There's a lot of street medicine folks. There's folks that have worked on organizing, in South Los Angeles for a number of years. And so they're going to be part of the ecosystem of HEAL in LA.
Thank you. And next, I will pass it over to our Fresno folks, both Annie and Desi.
So I can stand and I'll introduce our lovely Annie. So my name's Desi Carmen. I'm actually one of the family medicine faculty at UCSF, and I'm visiting faculty at UCSF Fresno and our Fresno hub. I'll start by saying, for myself, I actually did an external global health fellowship, and I think it's worth sharing, like as an early career family medicine doc. I was trained in broad spectrum, and one of the things that I found quite frustrating in my first job was really feeling like I had the population that I wanted to serve, I had the mission of justice that I wanted to occupy, but I didn't have the mentorship and support. So I've been with HEAL now as faculty for about a year, and just blown away, one, by the curriculum, right, giving us the actual language that we need to use these tools when we're in our first jobs out of residency. But two, I think experiencing the beauty of working with a site fellow. It's really important when we're in these spaces as new docs to feel like we're in a new home. And I think the way that the HEAL model is set up with a physician fellow in true community with the people who are working at the sites that are serving our patient populations, we see the magic that can happen, and social medicine should be much more local than anything else. So I just want to highlight that. So in the time that I come to Fresno, I work at two of our sites. I do get to have the privilege of working with some of our UCSF Fresno family medicine residents. And I'll say some of the highlights here from the physician side is the large availability to keep practicing broad spectrum. Particularly for myself, I'm interested in obstetrics, and I can say there is no shortage of obstetrical patients here. We predominantly serve patients who work out in farm worker settings. There's a large Punjabi population. We also see a pretty heavy breadth of patients who are suffering from substance use disorder, patients with STIs. Fresno is one of the largest places in the country that suffer from chlamydia and congenital syphilis. So if you're interested in infectious disease, this is also the place to be. But with that said, I'll pass over to Annie Chang, who's one of our amazing site fellows who does some of the work in obstetrics, but not from the physician side.
Thank you, Desi. So yeah, like Desi said, my name is Annie. I am a health education assistant with the Fresno County Department of Public Health. And there's some of the work that I focus on with my with the program that I work in. I work in the Perinatal Equity Initiative program. So that program, we focus primarily on our Black and African American community, because that community specifically faces much higher maternal and infant mortality rates compared to any other race. And this is nationally, not just in Fresno. And so some of the ways that we address those disparities is focusing on expanding the doula workforce in Fresno. And for those who don't know what doulas are, they are birth workers who support a pregnant person throughout their pregnancy journey, both during pregnancy and postpartum. That's one of the things that we want to create more access to, so that moms who can use the support will have the support that they need throughout their pregnancy journey, and also not neglecting the partners and fathers of that family, because they too also need help and support. And so when the mother and father both work together and both receive support, the family wellness just thrives. And then also kind of tying along into what Desi was mentioning about Fresno having very high STIs and substance use. One of the things that we also want to focus on is prioritizing preconception health for both the birthing person and their partners, to kind of prevent uh, STIs being transmitted to their babies, and just overall promoting family wellness. So that's some of the work that I do at the health department. My heal experience has been nothing but great. At first, I was very intimidated. It was a challenge for me. I'm much more of a shy person, so it forced me in a good way to step out of my comfort zone. And the discussions that we have there, although it can be uncomfortable sometimes, it's so important that we get used to talking about the uncomfortable conversations, because that's reality. And so it's just been great, being able to be in the same room with other health professionals who are also going through challenges, but in their own unique ways. But at the same time, it also, this fellowship has been very empowering, because we are all in this together. I just entered the public health field, so it's still very new to me. I still have a lot of learning to do. And so knowing that I have this mentorship from the HEAL group to support me through my career, it's very reassuring. And so overall, the experience has been both a growing, it has provided me with both professional and personal growth. And so I'm just very excited to see what goes on from here.
Thank you so much, Annie and Desi. Um, Next, we will jump over to the Inland Empire with Milo and Jesus.
This is the part of the show that wasn't rehearsed. So my name's Milo Dover. I'm a social medicine fellow and family medicine physician. I work specifically at the RUHS, that's Riverside University Health System, Moreno Valley Clinic. So that's one of our core residency clinics for the family medicine faculty, for the family medicine program. And there, I've been continuing, most of my time has been spent taking care of patients myself, being afforded the time to actually take the time to speak to them, understanding what their specific struggles are. Additionally, a good amount of my time has also been spent precepting residents, helping teach residents and medical students, which has just been incredibly rewarding, especially being able to make sure that the importance of social medicine, the importance of the fact that we are working in a system, and that's able to make sure that they know kind of from the beginning how we are a team sport right now. Reasons that I'm very interested in the work that I do. I grew up in a small little town called Adelanto in Apple Valley. Both of those are about an hour north of the Riverside area, and in a region that we call the High Desert. I grew up needing programs like Medicaid. I grew up needing programs like EBT, like SNAP benefits and everything. And so I saw like how many people were working so hard and still not having access to the resources that they needed. And I've been really happy and really fortunate in this program that I'm able to work so closely with our community health workers, with our enhanced care management teams, to help try and bring people the resources that they need, and even more importantly, resources that are already available that they just aren't knowledgeable of. Um, I touched base that I specifically have been working a lot on the community health worker and kind of the service navigator landscape. So that's essentially the people who help connect patients to the resources that are actually going to be beneficial to them. So that's a big part of what people like Jesus do is they're able to talk to patients. They're able to get to understand the patients and their needs in a way that a doctor simply doesn't have time to and be able to connect them to the resources, whether it's community resources, whether it's state resources, whether it's federal resources that will make a huge difference in their life. For something special, love the Taco Station restaurant in Riverside. Absolutely love it.
So my name is Jesus Pacheco, and I work east from the Riverside area and the Coachella Valley, which is connected with Palm Springs, Indio Thermal, Mecca, more of the cultivation area of the desert. And I work at the RUHS Community Health Centers. So how one of our colleagues was saying, my duties is to go out there and look for resources for people that are not aware of them. Because they all have insurance, but they don't all know the resources that comes with the insurance, the benefits. And my duties are go also making sure that they stay level with their health care. For example, if patients have high blood pressure, diabetes, any chronic disease, um, and a lot of our patients have stage cancers and stuff. So my job is to go to their house and do a face-to-face interview with them, making sure that they are taken care of, at least if they can't come to the doctors. Also, my other duties are just to be able to go with them to their appointments. That's one of the privilege that I have that not most of the my coworkers have, and it's a privilege that they have for somebody that may speak English and Spanish to be able to translate for them because not a lot of clinics or doctor's office have the opportunity to have somebody there and explain what's going on. And for being in the HEAL program, it has been very rewarding. Um, how Annie said, it was something that I wasn't expecting. I was something that I was like, well, what am I gonna do with all this doctors and physicians? I have no experience or anything regarding that. But once I started to do the training, I noticed that we're not so different just because the title is the title, but we all are here together to make the best and learn from each other and be able to take care of our, how we say, our residents, our patients, navigating through the health system. It has brought me a lot of joy to know that there's other people doing the same work that I am doing. Also, taking out of my comfort zone and making me a better person to be able to produce better services to our patients and residents that I serve here in the Coachella Valley.
Thank you so much, Jesus and Milo, for sharing more about the Inland Empire, as well as sharing more about your experience as fellows in the IE. All right. Our next poll, we'd love to hear what hub most interests you. Thank you for launching, Varsha. We'll give y'all about 20 seconds, and it's also okay if you don't know. Cool, I'm seeing some mixed results. Exciting. Lots of not sure, lots of Fresno. Great. Thank you. Okay, for our final portion of the presentation before the Q&A, I'll do a quick rundown of the application process and how you can become a part of this community. So our applications for social medicine fellows opens up on June 17th, so in a little less than a month. In order to apply, it's a pretty short and straightforward application. You can go to our HEAL website. You'll start the application. It's through a Google form. Some notes about the app. Please include 3 references. These are not letters of recommendation. These are just references. For more detail on that, what we do is email them asking just a couple of questions. And for the references, we require at least one program director from your residency, I believe one other, someone who can speak to your clinical work, and then a third reference that you would like to include as well. And then there's also a couple of personal statements as part of the application. An important note, because the application is a Google form, we highly recommend you write the personal statement on a separate Word document or Google document. That way you don't lose it and then can easily copy and paste it into the Google form. The early priority deadline to apply for this program is September 15th, 2026, and the application will officially close October 15th, 2026. If you have any questions about the application, my email is on the screen, and I will also send a follow-up email to folks who attended this call and registered for this call to let them know when and how to apply as well. This is just reiterating the timeline itself. Apps open mid-June. Priority deadline is September 15th. And then in October, starting in October, the interview process will begin. Expect around 3-ish interviews, and that's a mix between the HEAL internal team as well as local leader and clinical faculty site leaders at the specific hubs you applied for. And then the applications close October 15th. Offers will be out by around mid-November, and then by December, our social medicine fellows will be chosen for the next class of HEAL fellows. So if you're wondering what makes a strong applicant for this program, we do require you to have completed residency by July 2027 in either internal medicine, family medicine, med peds, or pediatrics. Additionally, I think a strong applicant or a strong applicant would be someone who has a lot of passion and hunger for making a lasting, meaningful impact in the healthcare of resource-denied communities, and someone who is looking to serve and accompany resource-denied communities within California for the long term. And additionally, prior connection to California communities in the hubs we serve is a plus, but by no means a requirement. All right, and Varsha, if you want to launch the last 2 polls, and then we will get into the Q&A. So this next poll, in case you can't see it, is what part of the program seems most interesting to you? If you don't see an answer on here that you wish you saw that we didn't mention, you're also welcome to drop it in the chat for folks to see. I see a lot of folks putting mentorship, serving resource denied settings, the 30% protected time, the opportunity to work for a specific site and make meaningful connections. Great, it's split pretty evenly across the board. Wonderful. And Varsha, you can go ahead and launch the next poll. Thank you. All right. Do you plan on applying? Totally fine if you're not sure yet. Additionally, if you're interested in applying, if you're like, I'm not sure, I have more questions, feel free to email me and I can connect you either with Shri, our co-founder, who can talk more about the program. I can also connect you with our hub leads who serve as our mentors as well in the specific regions. And I can also connect you to our current fellows if you'd like to ask them a bit more about their experience. Great. All right, thank you. And for this next part, we will jump into a Q&A. I'm going to stop sharing my screen. Folks are welcome to come off mute and ask questions, drop them in the chat. Varsha, I'll let you kick it off.
Yeah, thanks, Avery. Yeah, like Avery mentioned, this is really a time for folks to ask any questions that are on your mind. There's a range of folks here, from folks who work at the clinical side to folks who've been in your shoes about a year ago, considering applying, including like many people who work on the HEAL team. So you can put it in chat. Um, and maybe I'll just kick us off with the starter question as folks think through that. Yeah, Milo, maybe we wanted to start asking you to share a bit of what does your week look like as a social medicine fellow as you balance the 30% like project work and health equity training and then the 70% in direct clinical care?
Of course. One of the things that was a little bit difficult for me when I was first starting, and like something that I had difficulty picturing, is like, what does exactly 30% look like? Like, how is that basically divided? The way that my program is split is essentially in terms of like half days. So if you think in half days, a week of 5 days has 10 half days. So that means that 30% is 3 half days for my social medicine work and 7 half days for clinical work. So for me specifically, just going through the, I guess, the granular nature of my schedule. When Monday mornings, I'm seeing patients on my own, so that's independently, with my nursing staff, taking care of them. Great thing is that don't have to chief patients, which is a very fun and interesting experience. A little nerve-wracking that it's up to me, but you get better at it. It gets better as you go on. Monday afternoons are usually some time that I have for fellowship level work. So Monday afternoons, it's usually like tying up any ends from any emails or anything I got from the weekend. Depending a little bit earlier in the year, I was spending a lot of time going out to other clinical sites to interview and speak to community health workers, other staff, other kind of levels of like ECM and that kind of work. ECM is the term for enhanced care management, which is a kind of generally a team that's a network of an RN, a behavioral health specialist, a community health worker that helps support underserved patients who are identified as being in need of those kinds of resources, which includes housing resources, includes coordination for appointments and everything like that. So it's usually Monday afternoons, maybe either catching up on emails, working on presentations that I have coming up, working on, I'm currently doing like a draft presentation for kind of my understanding of like the service navigation network of the Riverside area. Some amount of it is spent preparing for students and other conferences and stuff that we've been having. A lot of Monday afternoons, I've been working on a structural competency conference that both undergraduates, graduate students, and medical students from UC Riverside were helping organize. A lot of this work also carries over. Tuesday is my full day for social medicine work. So a lot of that same work is carried over into Tuesday as well. Wednesday for me in the morning is again seeing patients independently. Wednesday afternoon, I am typically precepting residents. So that's actually helping supervise residents. They'll see a patient, they'll chief the patient to me, and kind of based off of like I may see the patient with the resident, or any other kind of support they specifically need for that education. It's also taking a specific amount of time of identifying what are learning gaps that they need addressed, what are possibly like areas that they're lacking in terms of just clinical skills and exam skills, really just everything, kind of those things that come into the idea of teaching. Thursdays for me are full day of myself seeing patients independently. And then Friday afternoon, similar to Wednesday, morning is seeing patients myself, and then the afternoon is taking care of or is supervising residents. I do a little bit of work on top of that schedule. This is just mostly in terms of myself. So for particularly Wednesday afternoons, every other Wednesday afternoon, we have the Riverside Free Clinic, which is an incredibly important resource for people who don't have consistent access to healthcare, or even if they do have something like IEHP, are having difficulty accessing doctors and things like that. There, I'm supervising medical students as they are going through the practice of interviewing patients, doing their own physical exams, and helping them understand, okay, these are the barriers this patient is facing for access to resources. And these are what we have available that we can help connect patients to resources. Another one of another one of the fellows, the site fellow for my clinic, Rosie Kobos, she will also sometimes come out to that clinic, and she will again help with more the resource connection part, as very similar to her work as an ECM. Yeah.
Thanks so much, Milo, for sharing a bit more about your experience and your work, and just adding a caveat that each of these, each like hub looks different, and it's quite customizable to JD. So, if folks are interested in learning a bit more, Avery can connect you to any of the hub leads or people working in the hubs, because it'll look a little differently. But that was great to get a taste of it. Yeah, I wanted to give a moment here for questions from the group. We have a few other questions that we can ask just to help folks get an understanding. But yeah, anything else that people wanted to come off mute to ask or comment? Well, I'll share another question. Hopefully, this will continue to continue to kind of help people understand a bit more, and maybe questions will come up there. This is for everyone in the group. Mentorship came up in the polls as one of the things that people are really interested in understanding about the program. Yeah, would love to hear from folks. What is it like being mentored by your hub leads, and how have they supported your growth?
I can share a little bit.
I'm gonna just leave so that you can talk. Is that better?
What happened?
I was just saying I can leave so that you can talk.
No, it's okay. I
Hey,
have good things
folks,
to share about you.
I should turn on my video. Sorry, my name is Mohammed Khan. Shoaib is my preferred name, and I am the hub lead in Fresno. But I will deliberately step away so that Annie can openly talk about her experience.
It's okay. You can stay. No worries. Yeah, so I've had the honor of being mentored by Shoaib, who I am used to calling Dr. Khan, but he insists I call him Shoaib. And he has been a tremendous help in getting my little side project that I had assigned for myself. I wanted to write a op-ed on preconception health and what that looks like for men, and so just having his insight on that and his help has been a tremendous. It's just been very helpful because I couldn't get any word on paper for like the longest. And so having the extra push from him to just, oh, you just got to put something down on paper. Even if it's not like anything very cohesive, as long as it's something down on paper, it'll just get the juices flowing. And so having his support and his consistency to always just check in and help me on that increased my motivation to continue to write that op-ed, because I was lacking motivation for a long time. Even though it's something that I wanted to do, I just couldn't get words on paper. But his persistence and his confidence in me to do it, and also just encouraging me to not just think about like doing it local, but also thinking outside the box and going bigger, because there's so much potential in that specific topic of what preconception health looks like for men. And so, yeah, it's that mentorship. It's for me, it's always been a challenge to kind of like seek out help. And so I think Shoaib saw that in me too. So his constant check-ins really helped me got out of my comfort zone, and just being comfortable reaching out to him too to ask for help to get his thoughts on the things that I'm working on. And so yeah, it's one of those things where it's a blessing, and yeah, I'm just very grateful.
Thank you so much for sharing, Annie. I'm curious, Jesus or Milo, do you have anything y'all want to add?
Yeah, I'll ask some. The hub leaders are people that are very motivated people that encourage you to do beyond your expectations. Um, our hub leader in the Inland Empire Riverside is Dr. Bajwa, Mazam Bajwa. And for me, at least personally, he is one of the greatest humane people that I have met as a physician and as a personal. He, no, he'll read your mind and will come up with topics that, it might trigger things, but it's something that you needed to hear. Then, all information, he's always there. And personally, I have learned a lot from them. Um, Being in the HEAL program, it just had opened my expectations to doing things that I'm not really comfortable doing sometimes, like speaking. Um, but I think the hub leaders are one of the pillars that are important for the HEAL program because they just don't push you, but they make you do they make you become a better person than what you came in. And I'm sure coming out, we'll become much better person than what he expected us to do.
Yeah, I can definitely also speak to Mosum being an amazing person. Just love talking to him. He's very inspirational. But I think an equally important thing is it's easy to hear these stories about somebody who's amazing and inspirational and think, I can't do that. That's just something that's an inborn quality to some people. And I think that's something that's been really important for Mosem. And I'm sure Shoaib and the others are doing similar things on their own, but just peeling behind, like for a peek behind the curtains of understanding like there is a rhythm, there is a method to what people are doing. Things don't happen on accident. So he talks about the reason that he structures our hub meetings the way they are. It's making sure that we're in person. It's making sure that it's in a place that everybody's comfortable to speak openly. It's giving people time to speak. It's letting the conversations flow themselves. He's like somebody that I very much admire as like a presenter and a speaker. And he's talked to me like, okay, these are the ways that I do it. I write the speech. I take out keywords. I know that I memorize those keywords and I know what parts of the speech they correspond to. So that makes it easier to go back to that. So it sounds like a more natural rhythm rather than memorizing a speech. So it's kind of those kind of pieces there of essentially seeing like it's easy to assume that, oh, I don't know this yet, so clearly it's not something that'll ever happen. It's so important to recognize that so many of these skills of leadership are things that are taught and things that are learned. It's something that we talk about throughout HEAL is the idea of leadership isn't just because of your position, it's a practice, it's what you're doing, it's how you're doing it, and actually going into that knowingly and intentionally.
That's amazing. Thank you all so much for sharing that. Yeah, one more question to anyone in the group in a few minutes that we have. I guess actually let me pause there. Any other questions coming up from folks? And hopefully this feels we're a group that's casual, so you can ask any kind. There's no all questions are welcome here, whether it's logistical and nitty-gritty or anything else about the experience.
If
I
you
have a question.
because I remember you were unmuted for a second there, Purushottam, if I'm pronouncing that right, just before you head out.
Oh, okay. Melinda, I see you unmuting. Please go for it.
Yes, I wanted to know, do you have to have a college degree to qualify for the program at UCSF, or is it like high school diploma, or do you have to have a specific credential?
I can take this question. So to be a social medicine physician fellow, you do have to be a physician in one of the specialties we mentioned earlier, which is family medicine, internal medicine, med peds, or pediatrics. Melinda, my guess is you might be more interested in being a community fellow. An example would be Jesus and Annie, who can speak more to that. These are folks who are already working at either a clinic or a local health department or a community business organization, whatever, something health related that's non-physician work at a site in one of the hubs we already partner with. So if you work, say, at a local health department in Los Angeles or Fresno or the Inland Empire, then you could qualify to be a community fellow. Community fellows are not employed by UCSF. Only our physician fellows are employed. The community fellows join this fellowship as a professional development opportunity. Does that answer your question, Melinda?
Yes.
Okay. And to
Thank
be a
you.
community fellow, you do not need a college degree or high school degree or anything like that. You just need to have the job, if that makes sense.
Okay. Thank you.
And definitely something that I can really speak to and something that's been really important to me throughout a lot of this fellowship. Like you've heard how like people it's difficult to talk about like some people that we've known as like inspiring people like Dr. Bajwa, people like Dr. Khan. One of the things that's incredibly important through this fellowship is kind of the leveling of the playing field. It's the recognition that everybody has something valuable and something important to contribute. So it's one of those things, like I mentioned, like it's easy to think, oh, because I don't have this position, I can't do these things. Uh,
Mhm. Mm.
like I've mentioned, we have our community health workers, we have our behavioral health specialists, we have our research, our community engagement people, and I'm a doctor. And at the end of the day, all of us are working towards the same goal. Everyone has the same plans in mind. It's that nobody is above anyone else. It's kind of dismantling those hierarchical um, platforms that people tend to assume are what our society is based off of, and it's like a demonstration of it doesn't have to be that way. We can just work together.
Thank you for sharing that, Milo. I totally resonated with what you said about this is a team sport. I thought that was a really powerful way of putting it. All right. Well, since there are no more questions, y'all are welcome to jump off. I want to give a special thanks to Jesus, Annie, Milo, and Desi for taking the time out of their busy, busy schedules to join this info session. Thank you, Melinda, and to the many folks who joined to learn more about the program. And also thank you to Varsha for staying on for back-end support. And
Thanks
please
so
reach out
much.
if you have questions, y'all. Thank you so much. Have a good evening.
Thanks so much, everyone.